Hello everyone, welcome back to my channel. I am Shubha here. I hope you like this video. Please do like, share, comment and don't forget to subscribe. Today in this video, we will discuss about required evidences for self-assessment toolkit 5th edition for the standard COP 13. Standard COP 13. Anesthesia services are provided in a consistent and safe manner. Departments and the staffs involved in this activity are anesthesia department staff, clinical staff and quality department. Objective Element COP 13 speaks about policy and procedure for administration of anesthesia. Evidences: Anesthesia manual with scope of services offered should be in line with organization services and or list of surgeries performed. Objective Element COP 13B speaks about pre-anesthesia assessment by a qualified anesthetist. Evidences: Pre-anesthesia assessment form, a standardized format to be adhered in line with the ASA guidelines. Patient records, clinical conditions specific to demonstrate the care plan. Anesthesia plan with a clear description based on the clinical conditions, and any changes shall also be documented. Objective Element COP 13C speaks about documenting pre-induction assessment. Evidences: Documentation of immediate pre-operative evaluation shall be evidenced against the checklist. APC, a format shall be used to record the immediate pre-induction assessment. Objective Element COP 13D speaks about informed consent for administration of anesthesia. Informed consent for anesthesia, a separate consent with a clear indication on risk, benefits, complications and alternatives. Bilingual consent, the consent form shall be available in English and local language. Objective Element COP 13 speaks about monitoring during anesthesia. Evidences: Recording of anesthesia monitoring using a standard format. Monitoring parameters, all the parameters shall be indicated as headings for regular monitoring. Objective Element COP 13F speaks about monitoring and documenting of patients post-anesthesia status. Evidences: Documentation of post-anesthesia care, a care plan with a clear indication on post-operative instructions including condition-specific observations or warning symptoms and signs. Objective Element COP 13G speaks about criteria applied for transfers, appropriate records to illustrate adherence to the defined criteria in an objective manner. Evidences: Patient records, appropriate monitoring records as against transfer advice. Criteria applied for transfers, appropriate records to illustrate adherence to the defined criteria in an objective manner. Objective Element COP 13H speaks about documenting the type of anesthesia and anesthetic medications. Evidences: Anesthesia record shall have specific details in a chronological order which shall include assessment details, care plan and monitoring details, preoperative, intraoperative and postoperative instructions. Objective Element COP 13I speaks about procedures shall comply with infection control guidelines. Evidences: Documentation on the type of anesthesia planned and administered. List of anesthetic medication administered. Anesthetist name, date and time should be documented in the anesthesia record. Anesthesia manual with infection control guidelines and procedures. Objective Element COP 13J speaks about recording and monitoring of adverse anesthesia events. Evidences: Adverse anesthesia record and action report shall clearly have headings on adverse events to record any adverse event is encountered. Incident form with details on the adverse event recording for necessary root cause analysis and further for corrective and preventive action. Thank you for watching the video. Hope you like this.